You already know how important your heart is and why you should take steps to protect it and keep it healthy both now and in the future. However, despite the incredibly important role the heart plays in our lives, most know very little about it and how it functions. Aside from pumping blood, are you really able to describe much about the role your heart plays in your day-to-day life? The answer for many is no. So, today, let's take some steps to remedy that with a basic overview of the heart and what each major section is responsible for in the body. Basic function of the heart. Your heart beats over 100,000 times per day, and as it does so, it pumps approximately 5,000 gallons of blood throughout the body. With each contraction, the left side of the heart is receiving blood from the lungs and pushing it out to the remainder of the body, while the right side is receiving deoxygenated blood and passing it on to the lungs. More specifically, here is what each of the 4 chambers does in the process. What does the right atrium do? The largest veins in the human body are the superior and inferior vena cava. These veins take deoxygenated blood from the body and deliver it to the right atrium. From here, the right atrium contracts, moving the blood onto the right ventricle. What does the right ventricle do? Upon receiving blood from the right atrium, the right ventricle contracts and pushes blood through the pulmonary artery to the lungs. Here, the blood receives oxygen and loses carbon dioxide. What does the left atrium do? Once blood receives oxygen, it can return to the heart, specifically the left atrium, via the pulmonary vein. The atrium then contracts and sends the blood to the left ventricle, chambers of the heart. The heart is a muscular organ about the size of a fist, located just behind and slightly left of the breastbone. The heart pumps blood through the network of arteries and veins called the cardiovascular system. The heart has 4 chambers. The right atrium receives blood from the veins and pumps it to the right ventricle. The right ventricle receives blood from the right atrium and pumps it to the lungs, where it is loaded with oxygen. The left atrium receives oxygenated blood from the lungs and pumps it to the left ventricle. The left ventricle, the strongest chamber, pumps oxygen-rich blood to the rest of the body. The left ventricle's vigorous contractions create our blood pressure. The coronary arteries run along the surface of the heart and provide oxygen-rich blood to the heart muscle. A web of nerve tissue also runs through the heart, conducting the complex signals that govern contraction and relaxation. Surrounding the heart is a sac called the pericardium. Heart conditions. Coronary artery disease. Over the years, cholesterol plaques can narrow the artery supplying blood to the heart. The narrowed arteries are at higher risk for complete blockage from a sudden blood clot. This blockage is called a heart attack. Stable angina pectoris. Narrowed coronary arteries cause predictable chest pain or discomfort with exertion. The blockages prevent the heart from receiving the extra oxygen needed for strenuous activity. Symptoms typically get better with rest. Unstable angina pectoris. Chest pain or discomfort that is new, worsening, or occurs at rest. This is an emergency situation as it can precede a heart attack, serious abnormal heart rhythm, or cardiac arrest. Myocardial infarction, heart attack. A coronary artery is suddenly blocked. Starved of oxygen, part of the heart muscle dies. Arrhythmia, dysrhythmia. An abnormal heart rhythm due to changes in the conduction of electrical impulses through the heart. Some arrhythmias are benign, but others are life-threatening. Congestive heart failure. The heart is either too weak or too stiff to effectively pump blood through the body. Shortness of breath and leg swelling are common symptoms. Cardiomyopathy, a disease of heart muscle in which the heart is abnormally enlarged, thickened, and/or stiffened. As a result, the heart's ability to pump blood is weakened. Myocarditis, inflammation of the heart muscle, most often due to a viral infection. Pericarditis, inflammation of the lining of the heart, pericardium. Viral infections, kidney failure, and autoimmune conditions are common causes. Pericardial effusion, fluid between the lining of the heart, pericardium, and the heart itself. Often, this is due to pericarditis. Atrial fibrillation, abnormal electrical impulses in the atria cause an irregular heartbeat. Atrial fibrillation is one of the most common arrhythmias. Pulmonary embolism, typically a blood clot travels through the heart to the lungs. Heart valve disease, there are 4 heart valves, and each can develop problems. If severe, valve disease can cause congestive heart failure. Heart murmur, an abnormal sound heard when listening to the heart with a stethoscope. Some heart murmurs are benign, others suggest heart disease. Endocarditis, inflammation of the inner lining or heart valves of the heart. Usually, endocarditis is due to a serious infection of the heart valves. Mitral valve prolapse, the mitral valve is forced backward slightly after blood has passed through the valve. Sudden cardiac death, death caused by a sudden loss of heart function, cardiac arrest. Cardiac arrest, sudden loss of heart function, heart tests. Electrocardiogram, ECG or EKG, a tracing of the heart's electrical activity. Electrocardiograms can help diagnose many heart conditions. Echocardiogram, an ultrasound of the heart. An echocardiogram provides direct viewing of any problems with the heart muscles' pumping ability and heart valves. Cardiac stress test, by using a treadmill or medicines, the heart is stimulated to pump to near maximum capacity. This may identify people with coronary artery disease. Cardiac catheterization, a catheter is inserted into the femoral artery in the groin and threaded into the coronary arteries. A doctor can then view X-ray images of the coronary arteries or any blockages and perform stenting or other procedures. Holter monitor, if a doctor suspects an arrhythmia, a portable heart monitor can be worn. Called a Holter monitor, it records the heart's rhythm continuously for a 24-hour period. Event monitor, if a doctor suspects an infrequent arrhythmia, a portable heart monitor called an event monitor can be worn. When you develop symptoms, you can push a button to record the heart's electrical rhythm. Heart treatments. Exercise. Regular exercise is important for heart health and most heart conditions. Talk to your doctor before starting an exercise program if you have heart problems. Angioplasty. During cardiac catheterization, a doctor inflates a balloon inside a narrowed or blocked coronary artery to widen the artery. A stent is often then placed to keep the artery open. Percutaneous coronary intervention, PCI, angioplasty is sometimes called a PCI or PTCA, percutaneous transluminal coronary angioplasty, by doctors. What does the left ventricle do? After the left ventricle has received all the blood from the left atrium, it then contracts and delivers it back to the body through the aorta. Keeping your heart healthy. Now that you understand just how hard your heart is working every second of the day, hopefully you have an even better understanding of why it's so important to keep it healthy and how a healthy heart impacts every other area of the body. If you're ready to learn more about your heart health and what you can do to ensure everything works as well as it should, contact Cardiovascular Institute of the South and request an appointment with one of our cardiologists.
Thanks for watching. Please like and subscribe our channel for medical updates. Thanks. This video is brought to you by Anatomy of Whole Body YouTube channel.